Post-traumatic stress disorder. In Kurt Vonnegut's book Slaughterhouse-Five, Billy Pilgrim is experiencing symptoms of PTSD. In those days during World War II, nobody talked about PTSD, and the soldiers did not get any treatment. Today, many U.S. veterans and veterans around the world are struggling with PTSD. They do get some treatment, but it's not always enough. In this presentation, we'll examine what kind of treatments that are being used today and what kind of treatments that maybe should be used in the future. Veterans are bringing the war home with them. They live poor lives, and many even commit suicide as a result of PTSD. Are the veterans getting the right help from the military? And if not, where does the military fail? Studies showed that the military falls short in providing mental health care to the veterans with PTSD. The military health system does manage to get in contact with veterans suffering from PTSD, and many receive at least one session of therapy. The problem is that the system fails to ensure that veterans continue to receive treatment after the initial therapy sessions. They should at least continue with follow-up visits to a psychotherapist or physician afterwards, especially if they were prescribed medication. This is very important because a physician can help them take their medicine and also check that the prescribed medicine does not counteract with other drugs they're taking. There are two possible explanations as to why veterans do not continue to see healthcare providers. One explanation could be insufficient access to mental health professionals. Another explanation could be the social stigma connected with visiting a mental health provider. Many veterans fear to be judged by other people because they need help with mental problems. The military fails to provide the important follow-up care, and this is likely one explanation for why veterans stop their therapy and medication. This can have devastating consequences for veterans. Many wonder if the wars were worth it, also because the issues they're struggling with are often invisible to others. They feel disconnected from the community they live in, and many also lack a sense of purpose when they return home. This is also seen in Slaughterhouse-Five with Billy Pilgrim. He can't seem to find a purpose in life, and that's why he creates his own reality. Those suffering from PTSD need care and attention. The military should not pretend they do, nor should they only provide a few therapy sessions to them. The military needs a follow-up system so the veterans with PTSD are not left all by themselves.
In a 2017 study involving 5,826 United States veterans, 12.9% of them, roughly 699, were diagnosed with PTSD, considerably higher than those who aren't veterans. It has also been reported that on average, veterans reported 3.4 more potentially traumatic events during their lifetime. This is just another reason for why the government needs to do even more research in helping those who are in and out of the military with PTSD. It is clear and without a doubt that it can be very hard for a veteran to seek out treatment for their PTSD, due to the fact that they have to come to terms with it and speak about it directly. Culture's general stigma regarding mental illness is also a cause for veterans to avoid the treatment and help they need. So what can be done treatment-wise? With roughly 80% of veterans holding at least one other form of mental illness, the current typical treatment methods for PTSD are known as pharmacologic and psychological interventions, meaning the likes of behavior therapy and antidepressant drugs, like paroxetine, fluoxetine, and venlafaxine, as well as sertraline, being one of the biggest pharmaceutical treatments to this date. Many veterans, however, report that they find these treatments to be insufficient. Other lesser-known treatments, however, have been found to be a possible substitute for the treatment of PTSD, like acupuncture, meditation, and yoga, things of that nature. So what if these substitute methods of treatment don't work? What else can be done? Another form of treatment is known as transcranial magnetic stimulation, which doesn't rely on any medication or sedation and helps stimulate nerve cells in the brain to help fend off any damages done by PTSD. The use of cannabis has also been found as a viable treatment to help decrease the severity of PTSD symptoms. Cannabis at self-managed doses, at least in short term, can help veterans minimize any potential unwanted side effects or worsening of symptoms. A statement paraphrased from Assistant Professor of Psychiatry at the University of California at San Diego School of Medicine, Mallory Luffel. These couple of suggested treatments can be viable and should be studied more among the others stated here in our essay by the government, being that we also have more access to medicine, technology, and means of treatment today rather than, say, during the Second World War, where Billy Pilgrim had suffered tremendously from the effects of PTSD.
As we come to a close, we have discussed the various methods of treatment for PTSD among veterans, as well as how the government should take a deeper look into their military personnel, along with the treatments and therapy to help fight off the damage done by PTSD.